All right, guys, the big reveal is coming soon. Make sure to stay tuned. I'm going to give you the address and the phone number of how you can book an appointment and come see me at my new office. Everything's coming together. It's going to be fun. Stay tuned. Okay, guys, this was our Steatocystoma patient here. And we can see when I pull here, she's doing great. The pigment spots where we did some squeezing and poking before, in a very short period of time, are actually already fading to just light pink, and that's awesome. She does have a little indentations on some of them when we pull down, but not too bad. We're going to get some of these bigger ones here now today. Kind of just go through and get all the big ones until we start smoothing this area out. She's had removals in the past. It's caused some scars. Our goal here is to minimize that as much as we can. You can see this whole area. Looks like we're getting that accomplished because these are not going to leave hardly any scars at all. But it is going to greatly reduce the bumps in the area. So we're going to get her prepped and ready here. We'll see. We've got some collections of bigger ones up here. Just going to mark them and wipe everything down, and we'll get her set up and ready to go. Okay, so we have her anesthetized here, and you can feel these underneath. We're going to do a series of pokes here. That was a good one. You can feel that release right away. Slippery butter. So you can see on even some of these, get the bottom. I always come back and squeeze. She'll even get like a little indentation. It's not huge, but there is a little bit there. That one was more dry. The one right beside it was more liquefied. Very good. I'm not seeing any little sacs. Sometimes they'll protrude out a little bit. Thank you. They're not too bad. Let's do this. Ready? Mm-hmm. There you go. Little poke. That one you can see all the hairs in that too. Those ones. Modified forceps. There we go. Yeah, if I push too hard, let me know. So some patients, when you push here, the sac really comes up right to the edge and you can grab it. She had a couple that we got out. Even if you tear a piece of it off, it makes it way harder for that sac to reform. And you can see she has a pretty good sac right there. So a little bit of tugging. And that one's coming out. Very good. If that's too painful, let me know.
Oh, no,
there.
I don't feel a thing.
Good. So that was a good size one. Usually just a little back and forth, and these wiggle right out. There we go. So that was a good one. And I remember she had a couple that came out very easily, and then a couple that didn't really move much. So I think this was like 2 of them. That was a bigger one. That's just a little connective tissue at the base there. Very nice. Okay, keep moving here. See if there's one. No, that one's not going to get much. We got about half on the last video. Some came out easily, some didn't. There we go. Very good. We'll pop a couple of these and we'll come back and check for sacs here. Good. Another one here. was one of the dry, kind of yellow, pasty ones. It always fascinates me, just the differences, even side by side, how different each one can be. Fluid at the bottom of that one. Oh, sac easily available there. That one I can see a little bit. And I have seen on patients I've had where things do regrow that even getting part of the sac is very helpful. Because I've had patients where, you know, we don't remove the sac and they don't regrow. Ones that we don't remove the sac and they regrow rather quickly. And I've had some of those patients where I partially just tear out even part of the sac and they haven't regrown. So that's a good thing. So if I can get even a little bit, it's worth the squeeze. That's the sac right there. That one's trying to come out on its own. Very good. Okay, that's good. This was that dry one here. See a big hair in that one. Good, got part of that. Okay, we'll move to the next grouping. Can you stretch there? It's okay, it's not bad. Here we go. Any pain there now?
No.
Good. It's like a little stringer there. There's a cluster in there I can feel. You know, it's hard to see around the corners sometimes there, sorry. That was a bigger one. He's got some filler in there. I can feel pretty good size. Not much left there or there. So you can see the ones where I got the sacs out, she actually does have a little indent. Not bad though, but on bigger ones, when you pull that sac out, you can actually have a pretty decent indent, which I have had patients not like in the past, but they don't like it, not as much as they didn't like the bumps though. So they're like, it's cool. Good, got the top of that one. Sometimes when I grab these sacs, just a cluster of vellus hairs comes out. I've had that happen too. There's a couple on that one. Just interesting. There's a little part of the sac there. Same with that, couple hairs. What I need to invent is like a tiny little hook. It's like 1 millimeter. You go in, twist, and pull.
That's smart.
It's like a specialized tool. Maybe we'll get that made for us. Good. Got part of the wall on that too. Good. Come to this next couple more clusters. There. That was like a pretty decent one. And there. one's actually a pretty deep pocket in the middle there. I felt that go in. Was that tender at all or not bad?
Good. I can't feel too much.
Good.
But I know that's like my problem area.
Yeah, right here in the middle. You've got a couple scars around it. I think it was just a deeper pocket. Might be another one right behind this one. This is a cluster potentially. Might be some scar tissue there too from previous removals. Yeah, I got some scar tissue I was feeling. Overall, not bleeding bad. This is very superficial, which is great. That's why it doesn't cause too much pigment or too many issues here. Yeah, there's a little sac right there. Some scar. I'm feeling that it's white scar tissue wrapped in that sac right there. That's what makes them harder to come out, but as long as I rip out kind of part of that sac, that one shouldn't come back too. Very good. Much flatter. We'll hit these three. Moving right along.
Those ones hurt a little.
A little pinch?
Just a little.
Okay. I can get you a little more light. Is that a little bit or not too bad? Okay. I'll get you a little more light up.
Thank you.
Yeah, a little on the edge here. It's bubbling out. I'm going to get you some of these last ones here too, just to make sure nothing's wore off. Squeeze some of these ones. We'll get a band-aid on that middle one there too. Pretty good size. I haven't squirted out the Lido. Very good. It does get slippery. A lot of people ask, like, do Steatocystomas, do they smell like a cyst? And they don't at all. There's really no smell to them. That sac was just waiting right at the surface. But they are very slippery. The oil that comes out, sebum that's in there, is very slick. So I go through a lot of gauze, but that's okay. That was a good sac there. I would say about 30 to 40% of hers are just perfect like that. They pop right out. You can see that one right there, same thing. Good. There's another one right in a row. All three of those popped right out. Last cluster down here. That one I can feel it. Almost off to the side right there. Nope. A little bit of pain or not bad?
No.
Good. There it was. That's a good one. That one squirted by. Let's just lie down. one's a cluster as well with some scar tissue. Can feel. Very nice. Making a difference here. I like it. You can see and feel those things shrinking. That's awesome. Little hairs right there. Let's see if we can get any sacs on these. And what's nice is after a couple sessions, I kind of have that first video of your first time here, and then we can really compare after 3 or 4.
So exciting.
Yeah, how much it's gone down. It's nice to see because it's a gradual thing. The tornado swirl. We swirled around and it pulls it right out. There it was. Good size sac on that one. Okay, let's see here. There it is, right by the surface. Got it. Another good one. A couple more. Very nice right there. Has some fibrous scar tissue with it. May have been one that was removed before too. Wow, it's really fibrous. There's hairs down in there too. It's just a drier one, I think. We got it. There it is. Good. Okay, going back up, we did 5, 10, 15, about 25, I think. That's really flattening this whole area out, which was where she was bothered the most, kind of in this middle area in the cleavage here. Look at that hair sticking out right there. Let's not leave that. Get that one. Let's see, that's part of a sac right there at the surface. The long hair in it. Now sometimes you can get some scissors or even an 11 blade down in there, but I've made such small cuts with this being right there, it's hard to get it past it. So we kind of do a little like tornado swirl here, a little circular swirl, and it kind of pulls out and detaches. So that's good. Just like that. And that's just some fibrous tissue at the top there too. But that's good. So liking the way this looks, we're going to get her a couple Band-Aids there. Thanks again to her for sharing. You can see these fibrous, these are kind of the connective tissue around. When we pull these sacs out, you'll see a little bit of connective tissue right there. That just dries up as part of the scab, but that looks great. Okay, you can come up here if you want. All right, so thanks again to her for sharing. These are actually some of my favorite Steatocystomas, these types. Their sac is right by the surface. They're not super huge, so even making a small cut, they're fairly easy to get out with minimal scarring. So when you can do that and really get the sac without much digging and not much bleeding because they're so superficial, we don't have to cauterize, which can cause skin pigment. So that's why I like these, because we get a lot of bang for our buck. We get them out, minimal scarring, no pigment or hardly any pigment after a couple months. So thanks again for popping by, and that's session 2. We'll have a couple more coming. Thanks.